Um, Next we move to Professor Govind Prasad. He's a professor at the University of Denver's Sturm College of Law. He is both a lawyer and an ethicist. He has been widely published on COVID, mainly focusing on issues of allocation, but also vaccine certificates in a number of areas. And he's been publishing, I think, since March 2020 on these areas, so has had a long time to think about it and to view. Professor Prasad.
Thank you so much, Zeke, and thanks everyone for joining. So what I'll talk about today, and I should have my screen shared, is shared now, is walking through some arguments for why considering differences in risk due to, for instance, being vaccinated as opposed to unvaccinated is actually both an ethical and an equity promoting response to the unequal harms of the COVID-19 pandemic. So I'm going to start on this first slide by recognizing something that Professor Verbitsky also talked about, which is COVID-19 vaccine access right now is, I think, starkly unequal. But where I think I disagree is that it's unequal just as access to many other means of travel is unequal. And unequal, again, here I disagree, I think, for similar reasons. So passports, visas, driver's licenses, access to vehicles like cars, the money to buy plane tickets, all of these things, in particular things like money or passports or visas, those are things that, just like the unequal access to vaccines, we could change and we create through social policies. Passports are required because we make them required. Same for visas. Same for the fact that some people have less money to purchase something like an airline ticket. These are all factors that we could change through social policy. Yet responding to unequal access by ignoring real differences, especially differences pertaining to risk between folks who are vaccinated and unvaccinated, I think is ethically a mistake. So people who aren't licensed can't drive or can't fly a plane. And we don't think it would be a good idea for safety reasons to allow that. And despite the fact that access to the means of being able to drive, being able to learn to drive, being able to own a car, certainly access to things like learning how to fly a plane is very unequal. Yet we don't ban those practices despite unequal access. And I think ignoring differences in risk is likely to especially hurt folks in low and middle income countries who are vaccinated. I'll talk about that in the next slide, because it will lead to differentiation based on nationality rather than based on public health risk. So I think equitable vaccine access is crucial, but the unequal access isn't unique to vaccines and doesn't justify ignoring real differences in risk. So this next slide, I want to talk through sort of table of different policy options. One policy you see in some countries like Australia is a sort of strict border closure. So the pros of this policy is it treats prospective entrants to a country all the same. They're all treated identically, although it treats folks who would like to get in very differently and burdens them much more than folks who are inside already. It also limits the unequal harms within the country of COVID spread. But it has serious costs. Not being able to travel across borders causes an unequal economic and social harms. Folks who have families in other countries or whose businesses or livelihoods depend on travel are burdened much more than people whose lives are based within national borders. More generally, excluding people who are vaccinated and pose a much lesser public health risk arguably violates the idea from public health law and policy that means to protect public health need to be the least restrictive means. Turn to another policy, open entry. This would treat everybody identically and avoid these unequal harms of closure, but it would lead to more spread of COVID-19, which would in turn cause large, unequally distributed harms that are both direct and indirect. And it would also generate, as I mentioned before, pressure to move from wide open entry to excluding some based on nationality rather than public health risk. The last option, I think, is vaccine requirements, which avoid, I think, both the unequal harms of blanket closure and the unequal harms of COVID spread. And their con is that they treat people differently based on vaccine status. So this last slide, I want to think about just briefly some ways that we might implement more fairly efforts to require vaccination and certification for travel. One possibility, as Professor Chernoff talked about, was, should we allow testing and quarantine as alternatives? And I agree with her that that doesn't protect against the problem of getting infected later, getting sick, spreading. If this option is going to be used, however, you could at least have countries that supply vaccinate visitors upon arrival to try to reduce the risk of those outcomes later on. Another issue, which I believe Professor Moodley will talk about, is I do think it's important to avoid what I call pretextual vaccination requirements. If two vaccines are similar in protection, or they're the same vaccine, like Vaxzevria, AstraZeneca, and Covishield, they shouldn't be treated differently. It can be okay to treat different vaccines differently, but not the same vaccine as a pretext for nationality differences. One could also pursue having an entry fee to fund global vaccine access, just like the September 11th security fee allowed funding of airport security. You could have an entry fee that is used to, in turn, direct money from international travel to fund broader global vaccine access to make that travel possible for all. Eventually, I think, not maybe in the next 6 months, certainly maybe not even in the next 24 months, although I hope not being vaccinated is going to be a matter of choice, not access. And I think excluding people who are unvaccinated through choice is less concerning than those who are unvaccinated through lack of access. The goal should be a fair chance to travel, not allowing travel irrespective of risk. So thanks so much.